Okay, so again, we love to see the impact that sealants are having, and the research is supporting this. So this was a AAPD Foundation grant that paid for a study, and what they were monitoring and measuring was really the benefits of a fluoride-releasing sealant in primary teeth. They wanted to identify, now that sealants release fluoride, is there a measurable anti-caries benefit to the teeth? And really what they found is, yes, fluoride release from Pitt & Fisher sealants provided a protective effect against a constant cariogenic challenge, not only for the tooth that's sealed, but also for the adjacent surface enamel. And that is huge. Okay, so not only does the sealant protect the teeth that it's sealing off, but the fluoride release provides a benefit to the adjacent surface enamel, which is awesome for us. Okay, so again, sealants are not only to help our children, but as we've shared previously, individuals 40 years and older also benefit from a sealant, especially if there's dry mouth or health risks going on in those patients. So again, changing our vision and opening our mind to talking about sealants with adults is probably a significant change for some of us. Okay, so again, where do you stand on that? Have you reviewed your treatment planning for predictability with your doctors and identified what their ideal protocol is? Are you sticking to that? Okay, so again, this is a conversation that's really critical, and what we see is hygienists that are flourishing and doing a lot of sealants most definitely have the support of their doctors. So sometimes if we don't have clarity on what our doctors are comfortable with, we lose confidence and we don't talk about sealants and recommend sealants. Okay, so this is something, again, that a lot of our patients desperately need. We know that even early stage cavities can be arrested by sealants. Okay, ADA research says that even cavities large enough to be seen on an X-ray do not become worse when a sealant is used. Again, many of us, if it's large enough to be seen on the X-ray, we're most likely not placing a sealant there, especially if we've got our Dagnodent and other cavity detecting lasers that can help guide us to the size and depth of the problem already. Okay, so again, the sealants that release fluoride are just awesome. So when we recommend sealants on adults, honestly, the best strategy I've found after you screen with the Dagnodent, especially if it starts making that warning sound, is to say, you know, something has started there. Bacterial involvement in that groove, it's an early stage cavity. We have two choices, right? We can wait and do nothing, and at some point, it most likely will progress to the point you'll need a cavity. In fact, ADA research says 95% chance that they'll eventually get a cavity if nothing is done. Okay, or we can place a sealant and hopefully prevent it from becoming worse. And many patients will choose the more conservative, the preventive measure, okay, especially if we help them identify that the cost, the investment for the sealant is often less than their copayment for a filling. Okay, so helping them see, giving them the opportunity is important. You know, let them decide what they want to move forward with. Again, this is a copy of the resource that we provided with you that has the longevity studies by Simonson for your reference and for patient reference. When they understand what's in it for them, many patients get excited about sealants. Okay, now keep in mind, the ideal process is again laid out for you in some of the resources that you have. Now, obviously, if a patient has a high level of restorative needs, sealants are going to go on the back burner, right? The last thing we want to do is do all the sealants before they actually get the restorative taken care of. Sealants are an elective procedure, but again, with many patients, especially those that have gotten to where they're stable with restorative, they get excited about the opportunity for a sealant. So how are we doing with that? Okay, how are you doing with that? Might be some opportunity to improve. Keep in mind, a lot of our patients are very high risk for decay. And so they really do need everything we've got. Okay? There's some powerful images here, right? I mean, it's only a matter of time before those white spot lesions can progress into cavities and big problems. There's nothing, in my mind, there's nothing more distressing than a teenager whose parents have invested $5,000, $6,000, $7,000 for ortho, complex ortho, and you take those brackets off, and what do we have? Widespread demineralization. And that's just a shame. Okay, so again, these patients desperately need the risk assessment conversation so we can hopefully prevent some of this widespread destruction from happening.